Imagine waking up every day feeling like your body is betraying you. Your periods are unpredictable, your skin is breaking out like you're a teenager again, and no matter how hard you try, the weight just won't budge. Sounds familiar? You're not alone. Millions of women are silently battling a condition called Polycystic Ovary Syndrome, or PCOS, and many don't even know it. Today, we're diving deep into the symptoms of PCOS, because knowing is the first step to taking back control. Let me tell you about Angela. She was 28 when she noticed her periods started coming whenever they felt like it, sometimes skipping months entirely. She brushed it off as stress. Then came the acne that wouldn't quit, and strands of hair falling out every time she brushed. Sarah felt embarrassed, frustrated, and honestly, a little scared. Was something seriously wrong? When she finally saw a doctor, the diagnosis hit her like a ton of bricks. PCOS. Angela's story is one of millions, and it's why we need to talk about this, because the symptoms of PCOS can sneak up on you, and they're not always what you expect. So, what exactly are the symptoms of polycystic ovaries? Buckle up, because this condition is a puzzle, and every piece matters. First, let's talk about irregular periods. Maybe your cycle is 35 days one month, 60 the next, or maybe you've gone months without one. Studies, like one from the Journal of Clinical Endocrinology and Metabolism in 2018, show that up to 70% of women with PCOS experience irregular or absent periods due to hormonal imbalances. It's not just annoying, it's a red flag. Then there's the weight struggle. Have you ever felt like you're doing everything right? Eating healthy, exercising, but the scale won't move? PCOS can make weight gain easier and weight loss feel impossible. Research from the American Journal of Obstetrics and Gynecology in 2020 found that insulin resistance, a common PCOS feature, messes with how your body processes sugar, leading to stubborn weight gain, especially around the belly. Now, let's get real about something that hits hard: skin and hair changes. Acne that feels like it's taken over your face? Unwanted hair growing on your chin or chest? Or maybe your hair is thinning on your scalp. These aren't just cosmetic issues. They're signs of excess androgens, or male hormones, which are often elevated in PCOS. A 2019 study in dermatology confirmed that up to 60% of women with PCOS deal with hirsutism. That's the medical term for excess body hair. It's tough, and it can make you feel like you're fighting a losing battle. But wait, there's more. Ever feel so tired you can barely get through the day? Fatigue is a sneaky PCOS symptom, often tied to insulin resistance or poor sleep from other symptoms like anxiety or sleep apnea, which are more common in PCOS, according to a 2021 study in Sleep Medicine Reviews. And speaking of anxiety, PCOS doesn't just mess with your body, it can mess with your mind. Mood swings, depression, and anxiety are reported by up to 40% of women with PCOS per research in human reproduction from 2022. It's like your hormones are staging a full-on rebellion. Here's where it gets curious. PCOS symptoms aren't the same for everyone. You might have irregular periods, but no acne. Or maybe you're struggling with infertility, another heartbreaking symptom. Did you know that PCOS is one of the leading causes of infertility in women? A 2023 study in fertility and sterility found that ovulation issues in PCOS can make getting pregnant a challenge for up to 80% of affected women. But here's the kicker. Not every woman with PCOS has cysts on her ovaries. Confusing, right? That's why diagnosis often relies on symptoms and blood tests, not just ultrasounds. So why should you care about all this? Because PCOS isn't just about missed periods or a few extra hairs. Left unchecked, it raises your risk for serious issues like type 2 diabetes, heart disease, and even endometrial cancer. A landmark study in The Lancet in 2020 warned that women with PCOS are twice as likely to develop diabetes by age 40. Knowledge is power, and spotting these symptoms early can change the game. Now, you're probably wondering, what's next? If any of these symptoms sound like you, don't wait. Talk to a doctor, preferably one who knows PCOS inside out. Blood tests, ultrasounds, and a good conversation about your symptoms can confirm if PCOS is the culprit. And the good news? There are ways to manage it. Lifestyle changes, medications, and support can make a world of difference. Angela, who I mentioned earlier. She's now managing her PCOS with a tailored plan, and she's feeling more like herself than ever. Here's the thing. PCOS thrives in silence. Too many women suffer without knowing why, and that's why we need to spread the word. If this video hit home for you, or if you know someone who needs to hear this, please share it. Like this video, subscribe to our channel, and let's keep this conversation going. Together, we can shine a light on PCOS and help women everywhere take charge of their health. You with me?